Hi, my name is Rachel Hissom. I'm a nurse practitioner in the Department of Otolaryngology at Johns Hopkins. And today I want to talk about vestibular migraines. Migraines are episodic attacks that are commonly thought of as a headache, but they can have less common dominant symptoms such as dizziness, ear pain, sinus pressure, or even tinnitus or ringing in the ears. This is thought to result from an abnormal electrical signal in the brain that can cause hypersensitivity to stimuli. Vestibular migraines or dizzy migraines are one of the most common causes for episodic dizziness and can occur with a headache or sometimes even without headaches. Patients with vestibular migraines may have a previous history of classic headache migraines, but this is not always the case. Patients with vestibular migraines usually report that their dizziness can last for hours to even days at a time and commonly occur along with light or sound or smell sensitivity, as well as in times where they see a lot of busy visual stimuli, such as walking down a grocery store aisle or scrolling on a phone or looking at a computer screen. Dizziness for these patients can also be triggered by certain foods or weather changes or even hormonal fluctuations or sleep and stress. Vestibular migraines are diagnosed by taking a good history of the patient's symptoms, as well as ruling out other causes for the symptoms that they are having. Treatments for vestibular migraines include identifying triggers. Most commonly, there are food or environmental triggers that can play into a patient's symptoms. We also recommend that patients journal their symptoms and the foods that they're eating to try and better identify their personal triggers for their episodes. And all types of migraines are in fact a neurological condition, and ongoing management of a patient's symptoms, including any preventative medications, can be further discussed with a neurologist.